The content herein is for informational purposes only, not intended as medical advice, diagnosis, or treatment, and is not to be substituted for direct advice from your doctor.
Today's LymphCast program is proudly sponsored by VitaSupport MD, the makers of Vein Formula 1000 and Lymphatic Formula 1000. These MPFF-based nutraceuticals are backed by science and recommended by doctors specializing in venous and lymphatic disorders. Visit VitaSupportMD.com to learn more.
Welcome to LymphCast, the show that brings together doctors, other health professionals, and special guests to discuss lymphedema, venous disease, and other associated disorders, and what can be done if this is affecting your life. Now it's time to sit back, relax, as it's time to learn all about lymphedema, venous disease, and associated disorders on our show, LymphCast. Greetings and welcome to the LymphCast show, video and audio. This is episode 15. Glad you're with us today for another exciting show and a very special guest. Let me begin by introducing the panel. The founder and owner of VitaSupport MD, makers of Vein Formula 1000, Lymphatic Formula 1000, also the founder of this show from New Jersey, physician, surgeon, Dr. John A. Chuback. Greetings, Dr. Chuback. How are you, sir?
Greetings, Paul. I'm doing great. Thanks again for participating in our program and hosting. I look forward to a very, very interesting discussion this evening.
Yes, absolutely. I agree with you wholeheartedly on that. From Arizona, Dr. Monika Gloviczki. Hi, Dr. Gloviczki. How are you today?
Hi, everybody. I'm very happy to participate in this particularly important LymphCast. And I'm doing fine. No blizzards in Arizona, so I feel really privileged.
Okay. And the gentleman who will bring in our special guest from the state of Minnesota, Dr. Mark Melin. Greetings, Dr. Melin. How are you, sir?
Good, Paul. Thank you for hosting again this evening. And John and Monika, thank you again it's a privilege to co-chair or co-present with you both. And in the back of me is the Boundary Waters canoe area, which our guest actually knows the state of Minnesota quite well. He still has family up here, Dr. Alen Hargens. And just briefly, a couple of years ago, I was looking for guests to bring out to Denver for our initial space forum as part of the American Venous Lymphatic Society. And I reached out to Mike Davis, who's at the University of Missouri. I said, there's this really brilliant gentleman that is the first person that's ever written about lymphatics in space, flight, and astronaut health that I can find. His name's Dr. Alen Hargens. He's at the University of California, San Diego, and I just wish I knew somehow to get a hold of him. And Mike says, I know him, I'll connect you. And Alen returned an email the same day, very gracious, very kind. It was very humbling, Alen, to connect with you in that moment. And you've been such a mentor over the last couple of years, a mentor to so many people that we're going to get to hear about, all the way from a lot of PH students to people that have gone into medical school to people that have become core astronauts and have spent time on the International Space Station. And you've done some incredible benchtop work in your work at University of California, San Diego, that we're going to be incredibly privileged to hear about today. I'm going to screen share for 2 seconds here because I just want to bring up the slide that we used to introduce you at the American Venous Lymphatic Society meeting this year. And to me, it just, Alen brings up really your heart and soul and the vision that you had that was so supportive of everybody around you. So you were previously chief of the Space Physiology Branch and Space Station project scientist at NASA Ames Research Center through the year 2000, consulting professor of human biology at Stanford University through 2000. You've participated in a lot of research concerning gravity effects on cardiovascular and musculoskeletal systems of both humans and animals. And for anybody that's had the privilege of hearing your work in Africa with giraffes and head down tilt studies with snakes. It's fascinating. You were a co-investigator on the critically acclaimed and published study on the 12-month mission for the twin study that looked at genetically identical astronauts, one of who was on the station for a year, one who was earthbound, and that ability to compare has really opened the doors to so much of what we understand with translatability into how we treat our own patients. And then you were the recipient of the NIH Research Career Development Award, the Elizabeth Winston Lanier Award from the American Academy of Orthopedic Surgeons, and then recognition award from the American Physiology Society, and 2 NASA honor awards. The big one, the really significant one, is the Distinguished Public Service Medal, which is NASA's highest award, and is really a huge honor. And the Nicholas Andre Lifetime Achievement Award from the Association of Bone and Joint Surgeons. So, Alen, I just want to say what a privilege it is to have you with us today, and just such congratulations on a career well done and contributions that have really made a huge impact, not only for the astronaut crew, but also for just simply what we do in clinic. So my first question is going to be about, tell us on the right-hand side here, you're in an upright MRI machine that was used to study astronaut spine health. So tell us a little bit about some of this background and some of the work you were doing with this.
So thank you, Mark, and I want to thank everybody who is attending today. It's my pleasure to be here, and it's a distinct honor to be here. I was sitting upright, or as you can see, in an upright MRI, and we were interested in what happens to the spine of astronauts after they've been in space for 6 months. So we did these upright MRIs before and then after their space flight. And some of the interesting findings were that their spines became more straight. And this may be related to increased back pain post-flight. And then they also had a lot of muscle atrophy in what we call the anti-gravity muscles that are in the spine. These are the muscles that we use to maintain upright posture on Earth, but then they're not used at all in space.
So describe to us a little bit about, let's talk a little bit about space flight studies that try to simulate on Earth what happens in low Earth orbit. And then what is it like to then do the studies when they're actually in low Earth orbit on the station? Because you've been involved in both of those areas for many decades now.
So the most common posture that we use for simulating space flight on Earth is bed rest, or often we use what's called the head down tilt posture at about 5 or 6 degrees head down tilt. And the reason that we use that is it has a tendency to reproduce the fluid shifts from the lower to the upper body that we see in astronauts quite often. But the head down tilt or the horizontal bed rest simulation isn't that good because you always have gravity on Earth. So you have a confounding effect of this gravity vector that you always have in a bed rest study.
So when astronauts then, because there's the other potential very short period of time of almost no gravity in what's called the special flights where they go up and then dive deeply, or so-called parabolic flights. Have you ever had a chance to spend time in one of those airplanes?
Yes, I have. And it's very interesting. Most people get sick when they're on this parabolic flight. It's like a giant roller coaster, and you only get about 20, maybe 25 seconds of microgravity. It's not zero gravity, but it's some form of microgravity. And you can do some measurements on those flights, but again, because they only give about 20 seconds of microgravity, it's hard to do any long-term studies.
So I'm going to go to the next slide here. This is going to be the last slide that we see. And the reason I'm bringing this up, and then we're going to go back to the full screen so we've got everybody participating, but these were remarks made by President Kennedy back on November 21st, 1963. And they were dedicating a new aerospace medical health center in San Antonio that day. You can see in the background is his wife, Jackie Onassis Kennedy, and you can see the vice president, Lyndon Johnson, to the left as well. And at this dedication,
Mark,
yes.
Just want to interrupt you. At the moment of this picture, that is his wife, Jacqueline Kennedy.
Jacqueline Kennedy, thank you.
She became Onassis Kennedy after this photo was taken.
It was, and because it was the next day, obviously, was that fatal day in Dallas. So thank you for correcting me on that, John. During the ceremony, he made 3 statements, which I think are really profound to Alan's career. One is that medicine in space is going to make our lives healthier and happier here on Earth. Medical space research may revolutionize the technology and the techniques of modern medicine. And medical space research may lead to new safeguards against hazards in many environments in which we're at. And as I read these 3 statements, and I used this at the American Venous Lymphatic Society meeting this fall, again, it just represents what Alan and his colleagues have been working on for so many years, and the impact that I think the countless impacts that it's had on, again, astronaut crew, as well as just what we do in clinic. So, Alan, if you were to look back and talk a little bit about some of your animal research in Africa, and then your lymphatic research, your really visionary lymphatic research, just pull back kind of the veil of time on some of that data that you acquired and some of the research you did.
Mark, before we get to that,
yeah,
I just want to ask a very simplistic question. It seems to me that all of this space work, I'm sure there are other parameters with regard to psychological and emotional isolation and so forth, but much of what we're talking about today is going to be related to the zero gravity effect. Is that correct? That the zero gravity has on the human body?
Well, I think there's that aspect, John. And then when we look at those fluid shifts that occur in astronauts, many of those fluid shifts you and I see and Monika see when we take care of our patients in a 1G gravity environment. The gravity is just pulling the fluid shifts to the opposite end. But the impact on tissue, in a lot of what Alan's done, the impact at the cell level on the feet and the legs is, we're learning from the work that Alan's done to better take care of patients with those fluid shifts. Right.
Now, the other question I have, and this may sound ridiculous, but it's worth asking because they tell me there's no such thing as a stupid question, although I try to push the boundary sometimes. Other than actual space flight and space experience, is anyone working on, or has anyone worked on in the world of physics and so forth, trying to, other than this hyperbolic airplane flying, which only lasts 20, 25 seconds, et cetera, has anybody tried to create some sort of zero gravity or near zero gravity environment on Earth, or is that utterly impossible?
There's what's called a clinostat that you can put cells into, and it sort of turns in all directions. And so the cells never get to sediment. So that's a way to give zero gravity to cells, for example, maybe to tissues, small pieces of tissues. But again, that simulation isn't as good as if you put those cells or small pieces of tissue into actual spaceflight.
Obviously, human beings wouldn't tolerate life in the clinostat, it sounds like. But I'm glad that I asked, at least for tissue and for cellular material, it is a possibility to that extent that you've described. So thank you.
So Alen, describe some of the early work you were doing with fluid changes and understanding of how the lymphatics played a role in management.
So I never had a physiology class until I was a graduate student. I was a chemistry major at the University of Minnesota, and I'm still a golden gopher. And so I had a chemistry background, and so I was able to get into a laboratory of a very famous physiologist. His name was Pete Scholander. So on my first expedition out of Scripps Institution of Oceanography, I was able to go and work side by side with him on the Amazon River, and we were able to do some tilting studies of snakes. So we tilted boa constrictors and we tilted anacondas, and we were interested in what kind of fluid shifts occur in the tissues when you tilt one of these snakes head up or head down. So in those early studies, which we published in Science magazines, we found that the fluids in the tissues moved very slowly, despite large changes in the blood pressure. We didn't have the tools at hand to study the lymphatic system, but subsequently in some of our giraffe studies, we were able to incorporate some lymph studies.
I have a question there out of curiosity. Number one, why did you choose these large snakes for these head down studies? And number two, how does one immobilize a snake and have him cooperate or her in this in this unusual position?
Well, I'm glad you asked that question, and I do have some slides. Can I share my screen?
I would love to see this. Yeah, of course.
Let me go back to the original one.
I thought I was the only one with a Mission to Mars slide deck on my desktop.
You know, I was just gonna make the comment that it's what a privilege to look at a desktop that has Mission to Mars on it.
So here I am as a 23-year-old graduate student on the Amazon. And on that expedition, we developed a catheter, and I'll go to the show. So we developed this wick catheter to measure interstitial fluid pressure, or we just call it tissue fluid pressure. And it was connected by a saline-filled catheter to read out meniscus, very simple technique. And while the tissue was drying out, we could weigh it with the torsion balance up here. And so it worked very well. the reason why you want a wick on the end of your catheter is because usually when you put a catheter into tissue, it plugs up and you don't get a very good, very accurate measurement of the fluid pressure in the tissue. But if you put this wick in the end of the catheter, it increases the contact area so you can get a better pressure, a more accurate pressure of the interstitial or the tissue fluids. So here's one of our boa constrictors. We put him in a wooden trough, and in this case, we have him head up and head down. And this is my PhD advisor, Scholander, measuring the interstitial fluid pressure down in the tail. And so we published our results in Science, and we showed essentially that even though the blood pressure changes very much in the head and the tail, there's not much of a change in the interstitial fluid or the tissue fluid pressure.
So Alen, because we may have some people that are not medical savvy, what's the significance of the blood pressure change yet not much change in the subcutaneous fluids?
So as you know, when we take a blood pressure, we usually put a cuff around the arm, and I'm sure all of the audience knows that a normal blood pressure is about 120 millimeters of mercury over 80. Let's say it's an average of about 100 millimeters of mercury. So when you're lying down, this pressure is equal throughout the body, this blood pressure. But then when you're standing up, it's much higher in your feet than it is in your head. So let's look at this snake here. So the blood
I'd like to
pressure,
point out, has no arms. So taking this blood pressure has to be a little bit more challenging. I would have chosen an animal with an arm, but I'm not as smart as you guys.
but so usually in these cases, you have to put a catheter into the blood vessel to accurately measure the pressure. I guess you could put a cuff around the tail and a cuff around the head, but the most accurate way would be to put an open-ended catheter into an artery of the tail and the head. So even though we saw these large changes in blood pressure from head down to the tail, the tissue fluid pressure wasn't changing. So the importance of that is that the tissue pressure is regulated, and it's not dependent so much on the blood pressure. So your tissue fluid pressure in the tail is similar to what it is up in the head.
Vein Formula 1000 and Lymphatic Formula 1000 from VitaSupport MD are backed by science and sold in doctors' offices. If you're a physician who may be interested in prescribing or selling these excellent nutraceuticals, please call 862-246-7877 to speak to a representative today.
And does that have implications for lymphatic function, Alen?
Yes, I think so, because lymphatics are uniquely related to tissue fluid pressure. And because the tissue fluid pressure often moves fluid from the tissues into the lymphatic system. And so I have another slide to show that, but That's what tissue fluid pressure, that's why it's important.
That's very interesting, Dr. Hargens. And you studied the arterial pressures head to tail versus the tissue pressures, but I wonder, did you happen to take venous pressures?
Not for these snake studies,
Okay.
but we have done that in some of our human studies, and we've done it in giraffes. And I can show you some of our giraffe data too. So let's move ahead here. So snakes are very interesting from an environmental standpoint. There are some snakes like this one on the left that can climb up a tree. And usually their heart is closer to their head. So the heart is about somewhere in this area here, and it can adjust its blood pressure so as to perfuse the head of the snake. And it has there's some evidence that it has a tight skin here, and that it can regulate the blood pressure down here. So it's able to climb up these trees. Now, on the other hand, here's a water snake held up by an Aborigine in Australia. And you can see as soon as he holds the snake head over tail, all of the blood moves down to the tail. The snake will lose all blood pressure and perfusion to the head, and they die. So you could actually, and the heart is about halfway up by the body. So one could speculate based on this information that an animal or a snake that's exposed to many, many millions of years in space would have its heart right here in the middle, and maybe a person's heart would move to the middle, and that they would also lose this ability to say maintain an upright posture when you brought them back to a gravitational field.
So you're bringing up a really critical point, Alen, about adaptability of animals over the course of design and evolution. And it's interesting because here we have two different animals, and we would all look at these as, well, it's a snake is a snake. Yet you've just shown us how dramatically these snakes are different, and gets into a little bit of that thing called the hydrostatic indifference point. So where, and to your really excellent point, where I've never even thought about this, where the heart is located within a snake is going to be a function of the environment that snake lives in. And I know you've done some very similar work with bats who hang upside down all day as well.
Well, that's the bat is a wonderful model, and I'm trying to get people interested in that because they live most of their life upside down. So I think we can learn a lot from them, how, for example, how their vision has adapted to this upside down posture.
So clearly, if a bat is hanging upside down most of the day, their lymphatics in their neck are more robust. They can pump better to prevent the swelling from occurring in their legs. And it's where John and Monika, if we could somehow figure out that component to improve lower leg lymphatic functionality, we may not be dealing with quite the pathology that we deal with right now with febrile lymphedema.
Yeah, well, that's an interesting point. I'm just fascinated by all this. I'm still thinking back to the arterial pressure, how the arterial pressure changed in that snake model without a change in tissue pressure, where we know that when we see venous hypertension, especially chronically, that we do get tissue pressure changes with edema and so forth. So it's a fascinating puzzle, and you wonder what elements are at work to prevent that, for example, in the snake. And then, as you say, a snake is not a snake is not a snake. The snake that they studied with the arterial pressure behaved a certain way. This snake up the tree behaves a certain way, and the water snake is behaving differently also. So, of course, I'm not is it a hepatologist? I'm not a hepatologist. Herpetologist? Herpetologist, right? So I don't know the specifics of the microanatomy and the physiology of these animals, but it's obviously really fascinating.
So,
Yeah.
Monika, I was going to ask you a question, Monika, about what we know about micronized purified flavonoid fractions in terms of being able to maybe help overcome some of those hydrostatic pressure differences with improving venous and lymphatic function.
Well, certainly what we know that it has a stimulating activity on the lymphangion. So if you would look and make a movie of the lymphangion, if your animal or if any living being is fed with the MPFF, you see that contractions are more frequent and more powerful. Now, I don't know how it applies, because you are quoting this issue of the interstitial pressure in the particular snake, but is that the same for this water snake, for example? Because looking at the changes that you observe, maybe what you had with the boa model, it's just the question of the boa snake and not the other. So I'm not sure how it works particularly in the to help understand the human and the other species physiology.
So let me just say that the snake that's climbing up the tree is very well adapted to terrestrial or earth life, because it can counteract the effects of gravity. Now, this snake over here, the water snake, is not adapted to gravity. It's an aquatic snake, and it's more like an astronaut who's been in space for a long period of time.
I see your point now. You're saying that this, because it's an aquatic snake, that it's floating in water generally and in the water and not going in a vertical direction for any purpose, etc. And I didn't quite grasp that initially. I see your point much more clearly now.
Okay. Well, it's much more clear. And so I would be, because certainly you have the studies in the humans with the interstitial pressure. How does it look for human beings?
Okay, so let me go on to a few more animals, and we've already talked about the bat. And so how did they work? Living upside down all their life. And they have a very pronounced lymphatic network in their wings. So that could be studied. I don't think anybody has looked at the effect of the posture of a bat on their lymphatic function. So I think that's a very ripe area of research.
The other
I'm
The other
sorry.
I was just going to make about bats is they're typically a fruit-eating variety, right?
Yeah,
And obviously,
these,
it'd be very interesting to look at their flavonoid consumption, because within the flavonoid component, there is a lot of exactly what Monika was just talking about. Interesting, Alen.
yeah. So I think this is a wonderful model to look at, and the lymphatics are very easy to see, at least in the wings. The other animal that we've been very interested in is the giraffe, because they seem to be able to overcome gravity effects despite large changes in their blood pressure from their head down to their feet. I won't get into this in detail, but if they're standing up like this, and if you measure all of the pressure, here's the arterial pressure, the venous pressure, the capillary pressure we think is somewhere between the arterial and the venous pressure. We don't know, we didn't measure the capillary pressure per se, and the other factors are the colloid osmotic pressure in the blood and then in the tissues. What was sort of interesting is that they have a fairly high tissue fluid pressure in their legs, and based on these early data that we found, they should get swelling in their legs. I know a lot of the audience that we're speaking to today has swelling or edema in their legs. So anyway, so this is a standing giraffe, and then we decided to look at these pressures when the animal was moving around. So we hooked them up to a telemetry system, and here we are looking at the data as it's coming from the giraffe over here. And we found that these pressures were highly variable, especially down in the feet and in the tissues of the leg. So this led us to believe that they had a natural anti-gravity suit around their legs, sort of a natural compression leggings, if you will, that aided the blood flow back to the heart. So every time they took a step, their leg muscles would squeeze the venous blood right back up to the heart. And I think that's one of the ways we prevent swelling in patients with venous insufficiency or lymphatic problems in their legs.
And I was going to add in, Alen, when you look at the work that like Dr. Giovanni Mosti and Dr. Hugo Parch have done in that inelastic compression, and what you just showed for people that have to wear compression daily are patients with lymphedema, chronic venous insufficiency. This just exemplifies why it's so critical to have routine use of that inelastic compression component that our certified lymphedema therapists work so hard with the patients to achieve, and especially when patients are walking, because obviously you get that improvement in terms of the hemodynamic component, which improves overall tissue function. So that is there's direct translation from all that work you did into what we talk to patients about daily in our clinics.
Yeah, I think that's a very good point. It's very important for these patients to be able to ambulate and to have good venous return and hopefully good lymphatic function. And I think that's aided by this compression that here in the giraffes, it's a tight skin and a fascia that form the anti-gravity suit.
Yeah, it's a very interesting discussion. The other thing that I would add is, I think one of the things that has always been postulated, or perhaps you could even say that we know from an anatomical and physiological point of view, is that although a giraffe is obviously extremely tall, one of the major anatomical differences is that the position of the heart. The heart is more posteriorly located than directly over the front legs. So unlike the human being who's truly erect and the right atrium is sitting directly above the malleoli, so to speak, above your ankles, that's a major pressure phenomenon to have to overcome. The other thing that I think is so interesting about thinking about the giraffe leg and the anatomy for a huge animal, I don't know what Dr. Hargens can tell us what a giraffe weighs, but it's almost, it reminds me very much of a thoroughbred racehorse, how spindly and thin those legs are and delicate those legs are, with almost no soft tissue, it would appear, to even accept edema. So to your point of this Hugo Parch-like non-stretch bandaging that anatomically they've evolved to have, it's quite an interesting compendium of facts that allow them to have those thin spindling legs without edema forming. And then I would come back to your point again, Mark. I think, if I'm not mistaken, I'm almost certain that giraffes are vegetarian. So the amount of these leaves and so forth that they eat, I wonder how much bioflavonoid they're getting every day in their diet. It could be massive.
Right. I mean, think about the volume, just like horses, right, that they consume on a daily basis.
Yeah. I don't know, a giraffe must weigh 1,000 pounds or 500. I mean, it's a huge animal.
Well, and it does go back, I think, John, that's such a great point, because nutrition is so critical to how our bodies function. And there's been many studies that have shown, the Mediterranean style foods have such a huge benefit, probably lower in salt. It's a healthy cholesterol, and it's a lot of fiber and a lot of bioflavonoids that make a critical difference in systemic holistic health. It's not just eliminating the edema in the legs. We know that cerebral vascular, brain health and cardiac function is much better, and they're out walking more. They're out taking the sheep to pasture in Italy. So lifestyle choices do make a significant difference. Boy, it'd be fascinating to look at the amount of bioflavonoids these animals take on a daily basis, to your point, John.
Vein Formula 1000 and Lymphatic Formula 1000 from VitaSupport MD are backed by science and sold in doctors' offices. If you're a physician who may be interested in prescribing or selling these excellent nutraceuticals, please call 862-246-7877 to speak to a representative today.
Yeah, and the other component that I would also be interested to see what their sodium intake is.
Probably about 0.
I mean, honestly, it would be really interesting to know that.
Well, and you raise an interesting point that Alen can address, because one of the accelerators they found that created bone resorption in an astronaut crew on the station was elevated sodium levels. And Alen, maybe you can address that, because I know crew have typically heavily salted their food because their taste buds change and to keep up calorie intake, but they found that accelerated bone loss.
Yeah, so I think there's good evidence that if they increase their sodium intake, that has a detrimental effect on their bone.
Which raises the thought, and I have 0 evidence about this. I do know now that there's evidence that sodium connecting to parts of the lining of the blood vessels makes them stiff and they can't produce dilators. And so could our nation, who's the most calcium-rich nation in the world, yet we have one of the highest osteoporosis rates. Maybe there's a component of sodium that's also contributing to why we're having an osteoporosis issue in the United States. It'd be interesting to kind of look at that, especially given what we know about, because the space station is like an accelerator for aging. As I understand it, Alan, an astronaut will typically lose about a year's worth of bone in 1 month, like a postmenopausal woman.
Yeah, I think that's true. The bone loss is very fast compared to that on Earth.
And certainly then recovery, which you've also spent time on, is how do you prehab astronauts, and then how do you help them to recover when they return? Because I think we're going to see more of this in the next decade as more astro civilians start to spend time in low Earth orbit. And back again to all the work that you're talking about right now is going to be very applicable to all these average people going into space.
Mm-hmm. So can we move on to some space, like a mission to Mars?
We're fascinated just by the giraffes, Alan. You're gonna have to come back for that. I'm saying that a male giraffe can be between 2,000 and 4,000 pounds.
So this is very old stuff. I'd like to talk to you about some exciting new ideas.
All right, new stuff.
New stuff.
Unbelievable.
So also, what happened with these dinosaurs? How did they work?
That's really old stuff.
So maybe someday we can bring back these terrestrial dinosaurs and see how they were able to function.
Unbelievable.
And all of these animals have adapted to one gravity. And we know there's other planets that have different gravities. So probably the life on those planets has adapted to a different gravity too. So it would be interesting to see what they did.
How about, did you ever consider the ostrich as a model?
Yes, we did. And we studied some at the Omaha Zoo. There was a fellow there were a couple of fellows who proposed that there was a siphon effect that maintained perfusion of the brain. And so we went to the Omaha Zoo, but we only got one ostrich there, so we couldn't really make any conclusions based on that. So let me now here again, you can see what the effect of standing in a one gravity field is. And let's say the average blood pressure at heart level, if you put a cuff on the arm, is about 100. So up at the head, it's only 70 millimeters of mercury, mean arterial pressure, but down in the legs, down in the feet, it's 200 millimeters of mercury. So our bodies have adapted to that gradient of blood pressure from the head down to the feet. So if you put a person into space, like over here, with the loss of the gravity, the blood pressures are equal throughout the whole body. So we get a blood shift up to the head and a slower tissue fluid shift as well. So if you look at the face of an astronaut on Earth, it looks like this. If he's going into space, just look at this same astronaut. He looks altogether different with all of that puffiness or swelling in his face. And I've heard from some astronauts after as soon as they get into space and look at the other crew members, they don't recognize them because their faces are so puffy. Now, so one of the hot topics in space right now is what happens to these pressures and what happens to the weight of the tissues. So on Earth, we think we have a capillary pressure that moves fluid into the tissues, and then the fluid gets into the lymphatic system here. And this is our normal way that we maintain fluid balance in the tissues. We think when you go into space, at least in the head, you have an increase in the capillary pressure that moves more fluid into the tissues. And then also, because the weight of the tissue is lost, then that also gives more fluid movement, and it may overwhelm the lymphatic system. There's some evidence that the lymphatics, at least in rats that are exposed to simulated weightlessness, that their lymphatic function is very poor. So what do? We could put people on a rotating spaceship to give them one gravity, but this is very expensive. So a lot of people have been building these short arm centrifuges, but they don't work very well either, because you can't exercise normally on these short arm centrifuges, and the gravity gradient is very large from the head down to the feet. So what's wrong with the exercise devices that we have in space? Well, we have this bungee cord system that pulls astronauts down to the treadmill, but it has no effect on their blood pressures. And their blood pressures are, as I said, were abnormally high in the head. And right now, we've never had a centrifuge in space. So I don't want to go into this, but this is, again, we put identical twins into to bed for 30 days. One of the twins was able to exercise. The other one had to stay in bed all day, had to take a shower this way, and had to use a bedpan. So this was very difficult for our twin volunteers. We had female volunteers. It was even more difficult for them. And so we have developed a device, a lower body. Yep.
Did you anticoagulate those patients for that study?
No. There's been other studies that find that there's no problem with coagulation.
Okay.
In a bed rest model.
Yeah.
Using normal subjects anyway.
Right. Okay, great.
So what we've developed is a giant vacuum cleaner that sucks in the body halfway, and then that can generate body weight, and it could also shift the blood and the fluids from the upper body to the lower body. And I just want to show now how this thing works. Now, all of this suspension system, if you had it in space, you wouldn't need any of those suspension things like the backrest. You wouldn't need these bungee cords. So this is a person running on a treadmill at one body weight. And we've we've been able to get them up to 1.4 body weights very comfortably. So we think that we can reproduce the normal daily activities with what we call this negative pressure. And so this is our most common posture during the day. So we have another device, it's another suction apparatus to pull somebody in while they're seated. So I won't go into that in any more detail, but you can simulate sitting posture in space as well. So I think that's the end of my slides.
So,
And yeah.
Alen, this is fascinating. So what you're showing us is that by creating a lower body negative pressure, it can counteract the fluid shifts going to the head because there's equalization of the pressures across when you're in weightlessness. And so by having that draw or sucking on the lower body, you don't need the big centrifuges, and this ideally could help treat some of the impact. How long do you think astronauts or crew would need to be in a device like this each day to mitigate the risk factors of the fluid shifts?
Well, I think, this is a very comfortable device, and it reproduces. We haven't studied this, but you could easily reproduce the sitting posture, which is probably about 10 hours a day. Walking, you can reproduce with a treadmill, maybe 1 or 2 hours. Running, and then you don't have to use negative pressure during sleep. So the crew members would, as we do, lie horizontally. They would be essentially in horizontal posture.
Okay.
Now, I have another question. We talked about the giraffe leg and this fascial membrane that acts as a non-stretch bandage compressive device, preventing edema in the giraffe leg. So I wonder, is the skull behaving like a non-stretch compressive bandage around the brain, and is that why perhaps you're not having massive problems with cerebral edema as compared to your facial edema that you're seeing external to the skull?
Yeah, that's a very good point. And I don't really know how to answer that. There is some evidence that the astronauts have what's called a chronically elevated but low level elevated intracranial pressure, and that may be affecting their vision. That's one hypothesis. So, and then there's the astronauts are known to have sleep problems and cognition problems, and that might be related to the fluid shift as well. So all of these areas are ripe for further investigation in the future.
Well, it's very, very interesting material. I could go on and on for hours listening to you and asking questions and learning even about intraocular pressure, the potential for exophthalmos because the eyes are not being compressed, whereas the rest of the central nervous system would be, and so forth. So it's a fascinating area. I thank you so much for being our guest today.
So as you see, a lot of this space research and animal research has applications to patients on Earth, particularly ones who have edema or have compromised circulations in their leg.
I'm sure Dr. Melin would hazard a guess that somehow intrinsically involved in all of this is the great glycocalyx, and we're going to have to learn more about that as time goes by.
I think we'll pivot right off that question, John, and and in summary, we're going to all be together down in Miami in September of 2023 at the American Venous Lymphatic Society and Union of International Phlebology. And I just want to thank Alen again for his willingness to come and join us for a third year in a row, along with Scott Smith from NASA and some other really luminaries who have helped build this field. And it's the ability to have a vision to look beyond the horizon and to advance the science. And Alen, you've really been such a luminary in this area for so many decades, and it's a sheer honor to have you join us at these meetings. And I know people love speaking with you and hearing about your projects, and it really ends up being stimulating for us to be able to help treat our patients better. And personally, there used to be that legacy Tang that was on in the Apollo and in the Skylab, and I've talked to Monika and John about this before, but I do think there may be a role for these micronutrient components, so flavonoids, diosmin, hesperidin, and you've even raised it today with looking at some of these animal models and what they typically would consume and their lack of dealing with swelling when they're certainly at high risk for it. So there's lots of opportunities to explore here. So Monika, do you any closing comments that you have?
Well, I think it's really extremely interesting, and certainly it opens the door to the future potential treatment, not only for astronauts, but for the patients on Earth. And I would like to So I would like to know a little bit more about this negative pressure chambers, because maybe indeed for our patients with lymphedema, it could be something that would work. And it's really, it's great to see that this is potentially available for the future astronauts, as I understand.
And with that, thank you, Monika. Really insightful comments. Paul, I'm going to toss it back to you to let you wrap this session up today, which has gone very quickly as they do.
All right, sir. We want to thank our panel. Another interesting discussion on the whole issue that's out there, and we appreciate everybody being with us. From Arizona, Dr. Monika Gloviczki. Thank you, Dr. Gloviczki, for everything today. We'll see you next time.
Thank you very much for letting me in this program.
All right, very good. And we want to thank from Minnesota, Dr. Mark Melin. First of all, Dr. Melin, thank you for everything today. We'll see you next time, too. And then would you also take the honor of thanking Dr. Hargens as well?
Well, Dr. Hargens, I just want to thank you for taking time with us today to educate not only us, but our entire LymphCast podcast audience on some really dynamic, interesting work that you've done. And I just want to take this opportunity again to congratulate you on a legacy career and the fact that you're still contributing today. And I certainly, as a really privileged mentor, I really do appreciate your kindness and the time that you spend with each and every one of us.
Well, I would like to say that I'm only as good as my students. I have such wonderful students. Two of them have been astronauts. One of them is still an astronaut. So without my students, I'm sure that I wouldn't be on this program.
Okay. All right. Well, thank you very much. We also want to thank the founder and owner Vita Support MD. They make Vein Formula 1000, Lymphatic Formula 1000, and also the gentleman who started this show from New Jersey, physician surgeon, Dr. John A. Chuback. Thank you for everything, Dr. Chuback. We'll see you next time as well.
Sorry, thank you, Paul. It's always a privilege and an honor to be involved and on the program and have such esteemed guests. And I always thank Dr. Melin for his broad network of contacts and scientists, clinicians, and all sorts of fascinating people. And Dr. Hargens, thank you for being with us. It has really been a mind-expanding experience, and we hope to have you back again someday soon and to talk more about these fascinating studies you've done in the past and the work that you're doing now and going forward in the future.
All right, thank you very much. And again, this has been your LymphCast show, episode 15. Go out there and have a great day and evening. We will see you next time for LymphCast episode 16. Have a great day.